C-armor is to remain folded on the back table until the patient is draped. Unfold C-armor and present to another sterile team member. Remove the release paper to expose the adhesive tape. Center C-armor on the surgical site or area of imaging interest and adhere to the patient drape at or above the sterile field line. Note, C-armor should be applied to the patient drape preferably before the bovie and suction tubing are placed to avoid interference. Exert pressure on the adhesive using your hand from within the pouch to avoid contamination. When lateral imaging is required, release C-armor fastener tabs by grasping the support structure with thumb and index finger. Separate the fasteners by applying counter pressure toward the table with the middle, ring, and small fingers. Expand C-armor to allow the C-arm to rotate into the sterile pouch. Once the X-ray tube is at the full lateral position, you may release C-armor. C-armor will hold its position above the sterile field line. Note, the region of the C-armor from the patient drape to the support structure remains sterile. The area beneath the support structure that falls below the table height is considered non-sterile and contact should be avoided. When lateral imaging is complete, grasp C-armor's support structure and hold it above the table height. Rotate the C-arm back to the vertical position. Collapse C-armor by moving it toward the table and reconnect the fasteners. C-armor is ready for repeated use. Note, when collapsed, the sterile sides of the C-armor pouch fold in on each other, protecting against non-sterile contact similar to a hip drape used in arthroplasty surgery. Special techniques. When using C-armor for intramedullary nailing of hip fractures or subtrochanteric fractures, C-armor should be applied with 1/3 of the drape proximal to the greater trochanter and 2/3 distal, with enough length provided to employ protection for distal interlocking if distal interlocking is anticipated. When the C-arm is offset to one end of C-armor drape, as in lateral imaging of hip fractures or distal interlocking, leave the distant fastener attached to prevent the unsupported drape from falling below the sterile field line. If blood or irrigation fluid has collected in the sterile pouch during the procedure, suction this prior to deploying C-armor to avoid spillage onto the floor. For more information, please visit c-armor.com.